All right, everybody. Cameron Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. If you're looking to grow your practice, scale your practice, learn everything what it takes in order to put you in a position to run your practice like a business, all of these episodes that we create, they are to help you grow, scale, and become the next best version of yourself, and ultimately deliver an amazing patient experience. Guys, today I have two incredible guests on, a husband and wife show here. They have started an incredible business, and I was talking to them offline. They actually started this business in 1997, so it's not that often that I get the opportunity to talk to somebody that has had a business as long as they have. Most time I hear 2010, 2015, as we've advanced into the world of medicine and aesthetics and wellness. But today's story is unique, and today's story has to do with integration, right? And I'm going to bring in Dr. Jon and Michele. They have an incredible practice out of Indianapolis, and it's dental beauty wellness, exactly what it sounds like. They do dental, they do beauty, aesthetics, and wellness. And I truly think that this is the future of healthcare, integrated dental, aesthetics, and wellness. So I want to welcome Dr. Jon and Michele to the show. Thank you so much for joining.
Thank you, Cameron. Yeah, appreciate you having us on, Medical Millionaire.
Absolutely. I thank you so much for joining. I know that you're super busy seeing patients and running the operation and staff. But Dr. Jon, take us back. Take us to the origin story. Like, let's start here. When you first got into dental, you started in traditional dentistry we were talking about, but what made you start thinking differently? Take us through that journey.
So as you mentioned, 1997, both feet in dentistry, carried on for, decades as a dental office, thriving, doing great in our small community. After a while, just kind of felt a bit of, I don't want to say boredom because I've never bored, but, it mundane, kind of rote after, so many years, 20 years. So that's when we kind of got interested in facial aesthetics, just as a happenstance, Michele being interested in it. And we heard of a few local dentists doing some Botox, and I really had very little knowledge about the subject. So I have to owe Michele with kind of nudging me in that direction. And so that was 2018. And we've been full tilt in aesthetics as well. So we've incorporated comprehensive facial aesthetic treatments. And then most recently, wellness into the lineup. We also have a salon where we do hair. So all things dental, beauty, wellness by way of functional medicine, and then hair as well. So we got a lot under our roof.
Yeah, that's a beautiful rooftop. I'm sure there's a lot going on with inside the umbrella. Is this a one standalone building?
It is, yeah. So we built this building in 2004. So I had been practicing in a kind of rental spot, and so we built our own facility. So we have a nice big area with 11 treatment rooms, places hopping. Need more parking spaces. I think that's our only complaint right now.
That's a good complaint.
Yeah, it is. Really good.
All right. So if I was to come to you from a patient standpoint, I was to come to you, cosmetic dentistry, a full facial aesthetics. If I had hair, I guess I could probably get that done. Extensions, the full
you
service.
You can get that too. You sure can.
Tattoo. Okay, I get a tattoo. There's a treatment for Cam too in that regard. And then as evolving into wellness, peptides, GLP. So really,
yes.
Why go anywhere else? It seems that you are a one-stop shop to really help the patient with ease and true transformation across the board.
Well, that's absolutely right. We had the comprehensive treatment interest ever since we started with dentistry and wanted to be able to treat the whole patient, even though it focuses on the mouth, it's attached to the person. So we were always mindful to the individual, and it just became aware to us that the industry was such that dentists could do everything. And I'm pretty artistic. I paint. I do a number of things. Dentistry requires a bit of artistic hand and artistic eye and fine motor skills, and I have all of that skill already. And it just was an easy transition, and I really fell in love with it. We've been able to travel and meet new people that we just really weren't doing before with dentistry alone. So now we're running in circles where I'm one of the only dentists, but we're in the top 100 injectors in the U.S. And I'm proud of that. I'm really happy to be part of that group. It's a nice group of comrades that I can rely upon, and then I have my dental people as well. So we're just ever expanding.
I love it. I love it. Michele, from your perspective, when did you start seeing this shift happening? From what Dr. Jon was saying, he said you may have been the influence into bolting on the aesthetic portion. So when did you see this happening? Where did it go from traditional dentistry, dental practice into, you know what, honey, we're going to build something much bigger, and here's why.
Yeah. And we, like you said, we started in 2018, kind of taking some introductory courses and fell in love. Like a lot of people, I think, COVID was so impactful. And as a dental practice, we had to shut down by state law for 10 weeks. And, you're kind of sitting back and going, oh my God, what are we going to do? I mean, we had a staff of people, we have bills, obviously, and we have to shut down for 10 weeks. This is scary stuff, right? And our oldest daughter, she had recently become on board. And as backing up a little bit, we all three have degrees in exercise science. So we've always been passionate about wellness and so forth from the beginning. And during 2020, during that 10-week shutdown, is when we took our original dental office, which was a family dentist. We go to Trafalgar Family Dentistry. And we were like, you know what? Let's rebrand. And while we used that 10 weeks to really shift our focus and set some 5-year goals of where we wanted to go in the next 5 years. And that was 2025, and we accomplished all those goals that we set out to attain at that time. And we're always moving, we're always growing. We got other things planned too. But I would say that COVID shutdown was a pivotal point where we were like, okay, while we're closed, let's remodel some of these dental rooms and let's make them look more like spa rooms. And they could be multifunctional, And we had around that time bought our first couple laser devices. And honestly, dentistry was really scary, to open your doors back up for the first time and you have this global pandemic. It was scary. And so we opened very controlled and very slowly. I mean, we had to have, one patient in a room and then let that room aerate for a while and stuff. So while we were opening up slowly, the aesthetic seemed more comfortable and safer, and you weren't creating all these aerosols in the room, and it allowed it to grow. And then the other beautiful thing, and I'm sure a lot of other people would have the same story, is that everything went on Zoom, right? And for the first time, everybody's looking at themselves, they're working from home, and they're not liking what they see, right? So, people really started coming in, and even the dental people were afraid to come in. Some of our regular patients, they didn't even come in for a year or so because they were just afraid to be in that medical setting. But the people wanting Botox, filler, lasers, I mean, they were more comfortable to come in. And so that, I feel, is when we probably really had a pivotal shift and kind of rebranded, remodeled, and then with the intention of we wanted to expand upon this and bring on wellness as well. And of course, I mean, we do a lot ourselves, but we do have other staff. We have a nurse practitioner that joined about 3 years ago. And so she runs the wellness functional medicine side and does the peptides, hormone replacement therapy, IV, vitamins. And then, like you said, we have a hair salon we opened about 2 years ago. And so we have now a staff of 3 hairstylists in there. And then, we happened to be speaking at a conference in, I think it was Dallas. Mm-hmm. We happened to be there, and another speaker was speaking on bioregenerative medicine and PRF. And that really was a pivotal point too, because it really just kind of bridged everything and beyond just Botox and fillers and so forth, really expanded our thought process into the whole bioregenerative medicine and how that really expands across all departments. And even most recently this year, we've gotten into hair restoration with PRF. And so that really, when we timed the bringing in the salon, we knew we wanted to grow that too. And we're still working on the whole hair restoration, and our stylists do hair extensions and top pieces, and then we're doing the PRF, bioregenerative hair restoration, coupling that with supplements, blood work, different things like that too. So it's exciting to see across all our departments how that works. And you're right, somebody walks in, we have a lot of patients that they go, through all the departments, and they're like, well, I'll see you guys again in a couple days because I'm back to see the nurse, or, so it has gotten to be really popular, and those people are who we want, and they thrive because they are being supported on all aspects. And so that is the kind of client that we want, somebody that really is looking for dental health and wellness and then beauty, because we really, ultimately we want people to, look good and feel good and to be healthier.
Yeah. Well said. I think that it's interesting. Sometimes the world can give us an interesting hand and we don't realize it's a blessing in disguise. Mm-hmm. Giving you the ability to close down, rethink things, step away from the business for a second versus seeing patient after patient after patient, just kind of going about doing your job, gives you the ability to kind of zoom out, sit down from a macro standpoint, 30,000 foot view standpoint, say, hey, what do we have here? Where do we want to go? And having the blessing to be shut down, actually, to explore that, to remodel, to re-engineer, reconfigure the overall footprint that you guys deliver. And so, what I love about your story is this is not just adding services. It's a mind shift. It's a total shift in the mindset with the sense of, hey, we have patients coming in. They're seeing us for traditional dentistry. They're going to go somewhere for Botox fillers. They're going to go somewhere for the salon treatment. They're going to go somewhere for wellness, as that's obviously advanced in the recent years. Why not take care of our base now, right? And so just for the audience, for you guys that are tuning in, I would encourage you to stay with us right now and really, whether you're driving or walking or at the gym, this is a perfect example of a brand that has a legacy footprint within inside the community. And the community knows them as traditional dentistry. Well, these patients are coming to see them. And as they start to introduce the new mindset to them, right? This is all holistic. It's all under one rooftop. They now have, what they've done is from a business standpoint, they have increased patient frequency. They have increased their patient spend per visit. They're delivering extraordinary transformation across the board. In fact, I don't think I've had anybody on the show that is hitting every single vertical and pillar that you guys are hitting. So huge shout out to you. Thank you. Ultimately, it's creating a patient experience unlike anything I've seen before. Ultimate transformation, right?
Yeah, I can give you a great example too. Like recently had a patient in and she was just getting a facial, right? And I do have a background as well as in dental hygiene before I got certified to do lasers and so forth. So I'm doing a facial on her and, I'm just applying her skincare and I'm palpating her, masseters and like, gosh, these masseters are really, really overdeveloped. Do you happen to clench or grind, and she was like, oh yeah, I do. And so we talked a little bit about that and some treatments that we have, we can do some exercises, some physical therapy. We've got radio frequency devices. And we can do Botox, and that will help relax your masseters, and do TMJ therapy. And then, it got to, like, well, by chance, you don't snore at night, do you? And she said, my husband just moved out of the bedroom because I snore so loud, and I said, well,
you don't want that.
now we're talking sleep apnea. And, this is airway obstruction. And, and we can treat that. We have appliances and things that we can do to improve your quality of life and your husband's relationship with that. And 100%. So, one thing leads to another. So they might start out for a facial, but then they might end up, in the dental chair, sleep apnea study, therapeutic Botox, and then, one thing goes to another. You're like, well, I see here, on your patient intake form that you're saying that you don't sleep at night, or that you have, night sweats, like, and then it's like, gosh, have you ever had your hormone level checked? Well, let's get you in our lab here with our nurse practitioner and let's check that out. And so, even just something as simple as like a medical grade facial can turn into all these other services where you're really, improving the quality of that patient's life. And they love that, they love that you for helping them to feel better. And a lot of times I hear things like, no one has ever told me that before, or my doctor's office has never mentioned that before, because they're very constrained by time and what insurance covers. And so you step into this whole wellness and functional medicine space, and you really get to the root cause of helping people and improve their quality of life. And it's very, very rewarding and very impactshe too.
Yeah, I was really passionate about the dental sleep medicine because I was, having problems myself. She was ready to move out. So, I helped myself, and then I see how it has helped me. So, I wanted to offer that to others. And dental sleep medicine is a really a great addition to what we're doing, because if you're not sleeping well, the rest of it go out the window. And I tell you, not everybody can do CPAPs and all that, or want to. And dentists are the only ones that can make oral appliances. So you're kind of left with hoping that a dentist knows what they're doing. And honestly, we don't when we get out of school, and you have to continue that education to get the further knowledge that requires, but you can only learn so much in dental school. So, but by incorporating all that, our part of the wellness, has really thrived, and I really enjoy the therapeutic aspects of it as well. I know we do a lot of beauty, and that's great, but it's also really nice to see somebody who's suffered for 10 years with jaw pain, and you get them out of pain, and now they can sleep, and their days are better. And sometimes they just look better because of the sleep they get. So it's all together wonderful.
Saving sleep and saving marriages. You go from a hygiene service to increasing intimacy.
Marriage counseling, yeah.
Changing people's lives, for sure. I love that. And that's a big part of it, right? It's like, look, you want people to feel better, look better, but at the same time, depending on, the current situation, like if you're helping with intimacy frequency, I think that's a big thing, and I think everybody's going to be happy about that.
Oh yeah.
Yeah. So talk to me about this, because as I look at the business as a whole, obviously, there's a lot going on. And if I was a patient, how do you explain what you do, right? So for the first time, somebody hearing about beauty or dental beauty wellness for the first time, how do you explain what you do? Is that challenging? Do they come to you because there's a lot going on, right? So how does that process work?
Well, I do a lot of patient consultations, and again, I think you don't like to overwhelm people. I think often getting people started. We are in the Midwest. We're south of Indianapolis in a rural community, so our patient base is not like someone that is on the East Coast or West Coast. And so when we brought these services to this area, a lot of it was very new, people didn't know. And we always say, like, In the beginning, I think that facial aesthetic patients converted to dental patients quicker than dental patients converted to aesthetics. Because when we were trying to explain to our dental patients, I mean, we've been Trafalgar Family Dentistry for all these years, and we rebrand, come back with signage that says Dental Beauty Wellness, and your basic like 65-year-old males, like, beauty, what's that? Like, I don't want any of that beauty, but none of that Botox stuff for me. So it did take a lot of explaining, and kind of like I just said, like kind of telling people, like, no, our goal here is we want to support the whole patient. We want you to look better, feel better, educating, people, like just bringing on, like, Botox, cosmetic Botox is great and wonderful. But, people that might have a preconceived notion, telling them, do you know that we can use Botox to get people out of pain with their masseters from clenching? And, and sometimes that even goes hand in hand with sleep apnea and so forth. So, we have done a lot of talking and a lot of educating, and we still do. So, it is kind of bringing people on board. I think very gently, and kind of getting them started, and then kind of growing from there, and trying to, build a relationship with these people and tell them that, I mean, it's a journey that we're going to go through. There is no one or done type thing. And we're looking, to support you long term, and not overwhelm at first, but kind of sprinkle in a little bit about what we do, kind of get started with some introductory type non-invasive services, and while at the same time, addressing underlying factors, like that might, hey, you might want to schedule an appointment with the nurse over here, get some blood work, let's kind of look at how things look, because it is all tied together. Inflammation in the body, hormone levels. I mean, it really shows up on the face, or even in their mouth, so, and we're, as far as, dentistry, there's a lot of awareness on, bacteria that's, going to the heart, going to the brain, and people don't realize that, they think, oh, yeah, I hear you. You want me to floss my teeth every day. I don't have time for that, and it's like, well, do you have time for heart disease? Do you have time for Alzheimer's? Those kind of things. And when you educate people on that, then, all of a sudden you kind of do have a captive audience when you bring in the wellness factor to it, and it all of a sudden becomes very impactful in their lives.
Yeah, great point. Well said. And I think this is where some providers can potentially be missing it, is they may not understand the connection between oral health and aesthetics and overall wellness. And to build on what you're saying, they're all interconnected. They're all intertwined.
Absolutely.
Right. And it's an overall integration of transformation. And what I guess, to build on that, just a question for you is, let's start with dentistry. Like, where do you see traditional dentistry falling short today? Are they not catching on? Because you could look at them through the lens of, like, they're completely different. I can just go to my dentist, or I can go to the injector, and I can go to the wellness. Do you think more of them will start to catch on? I mean, I hear it. I don't see it as often as I hear it, right? In terms of having it under one rooftop. But yeah, what's your thoughts on that?
Well, I think there's a lot of people who dabble, and they think they want to get into it. And then, so for us, we really went into it knowing that we wanted to do comprehensive treatments. So that included a lot of coursework. We had to study, had to learn all these techniques and procedures, and so many patients. So we just have always strived on just doing a great job for people. Where dentistry is falling short, I think, the industry has kind of fallen wayside to the insurance companies. The reimbursement's low. So I think that dental offices will probably start to see how, we saw that fee-for-service procedures are pretty appealing, and you don't get that with reimbursement from insurance companies. You're working for half of what you used to get, working more and being paid for less. So I think the industry itself is going to have to look for other ways for income, and look outside insurance companies. We do cosmetic dentistry, which it is what it says. Cosmetic looks, improve your appearance of your smile. So that's not necessarily something that insurance recognizes. And of course, all the facial aesthetics is fee for service. Even the therapeutic, there's really not much by way of insurance company participation. So that's been our biggest thing, is just to find revenue where we can, and not have to write off so much.
Yeah. No, that's a great point. I think when you leaned in on it in terms of dabbling, see, because you hear the noise, you don't actually see the action.
Right.
And you're a great, perfect example of executing and seeing the vision, executing on the vision, seeing the path, and giving these patients true transformation. And really, when I look at the history of aesthetics, let's take aesthetics and just in the past, let's call it 2015 to 2022. If you look at I would call that more of a legacy era. It was a transactional type of approach. It was come in, get your treatment. Here's the bill. Go on.
Yes.
Call me when you need me. Those types of things. It's completely changed.
Yes, in the last few years, even.
We are desperate for transformation. We are desperate for expertise. I am desperate for the right answers. Like, let's talk about peptides and GLP-1s for a sec. You see it all over the internet, right? You can see it on TikTok. Take this, take that, buy it here, influencer, research lab crap. I'm a huge fan of doing things correctly, the right way, putting the power back in the provider,
right?
Blood work done, hormones corrected. Like, let's do it the right way, and deliver transformation. And that's where this creates this trust, right? This trust between patient and provider. And you guys are absolutely doing a wonderful job of that.
Thank you. Yeah, we really want to build the trust, and we always have. I mean, it's a personal relationship, and I think that's why people keep coming to us. And that's also, I think, why we have staff that's been around for decades. We really are interested in the people individually, each and every one. So it's a great occupation. I'm no longer burnt out. I'm happy doing what I'm doing. I got a variety. I got a great staff supporting me. I've been able to take off some hats and hand them over to others and delegate some things that were a burden to me, and focus more on the clinical aspects, and knowing that I got people who got my back on, some of the other things that dentists aren't that great at. I mean, I'm not a businessman, but you're forced to be. So I think I did well enough for my turn. Now I'm handing it over, and we're just seeing it, perform even better.
I like that. I think I'd give you a little bit more credit. I think you have the vision and the ability to see around the corner before others, and that's a unique asset to have.
I appreciate that.
Most people don't have that. Yeah. So you didn't just build a practice, you've built a platform. And so let's talk about business for a second. I think when we peel back the hood, talking about patient journey, what does your ideal patient journey look like across the three verticals? How do you integrate them together seamlessly?
Well, I think it starts with a consultation. Something we have added recently, I feel like on all fronts, is memberships. And I think that has been key, because it's from a business standpoint, not only from a business standpoint, because I don't want to make it sound like we're the ones that are benefiting. The patients are the ones that are really benefiting from the membership, and it holds them accountable. But memberships have been a pivotal point, and something we started adding a couple years ago. We actually started on the aesthetic side first, with having a membership platform with 3 different tiers. Our particular memberships tend to be service based. So they are facial based. So the person is coming in and they are getting a facial on a regular basis. Every like 4 to 6 weeks that patient's coming in. Then we have built in like what a lot of people call like a beauty bank into those tiers. So those patients are also receiving VIP pricing on other services. So that was really pivotal on a business standpoint because we're all busy, right? And when you tell someone, okay, yep, we stimulated collagen, we hydrated your skin, this is all great, I recommend you come back in 4 to 6 weeks. And they're like, okay, yeah, I'll give you a call. Well, we all get busy and sometimes that call doesn't happen and 3 months goes by, 6 months goes by. And so when we went to the membership platform, we really saw a transition in the patient satisfaction. They could see the transformation that they were seeing in their skin. And then at the same time that we were noticing positive growth with the membership platform, we noticed also on the dental side that, as we said, reimbursement became less and less. And dental insurance is different than medical insurance. And a lot of people don't understand that. Medical is different than your optical and dental add-on often. And you don't have the same, maximums and so forth. And so what we were seeing is patients on the dental side were, kind of getting lost in the shuffle a little bit too, and wanting to stick to only what their insurance had, or if they didn't have insurance, what it looked like. So we formed a dental membership as well. It's based on getting 2 cleanings a year, which is what the ADA recommends. And there's certainly room for, wiggle room there if somebody, needs more than that. And then getting them a discount out of pocket on their dental services. And then our nurse practitioner now has seen kind of that benefit of that and getting people on, memberships as well, whether it be a wellness membership or a hormone replacement therapy membership. So I feel like that has been a big pivotal point business-wise, and bringing patients on board with that. We, at this time, do not have one giant membership that does all the platforms, all the services we have. They're kind of individual. And we've even talked about expanding that into our hair salon as we ventured into hair restoration and so forth, getting people committed to that annual services and so forth going forward with the multiple treatments that are involved with that. So like I said, we probably, something that we have kind of done unique is that as you come in, we're the Dental Beauty Wellness Center, but you can visit the different departments. They're all interlinked, but we don't have one membership, at this time for all services that we provide.
Interesting. Okay. But what I'm hearing is higher retention, higher spend per patient, better 100%. Outcomes.
Yeah.
Yes.
Yeah. I would say most of our patients are in membership now. Certainly people come in, every 3-6 months, just get a Botox treatment and leave. And that's fine. But, those are not the patients that are really receiving the most benefit from what we do, and receiving the overall just wellness and looking better, feeling better, and so forth. So we really try to encourage people to go that way and explain the benefit of that. And I had a patient in this week, and she was a 77-year-old lady, and she had never had really anything done at all, a facial. And I had treatment planned her to start out with like a Q-switch laser and a facial. And I told her that, this isn't going to hurt. You're not going to have downtime. You're not going to leave looking all burnt and so forth. And so she came to her appointment. She was very, very nervous. And she said, oh my gosh, like, I'm so nervous. And like, oh, there's no need to be. You're going to walk out the door looking better than you came in, And she was saying how her friend has like called her 3 times today. And, like, as soon as you get done, tell me how that went. Come over to my house. I want to see how you look, And I was trying to explain to her, I didn't want to, oversell and underdeliver. So, I was like, tell your friend Marcia, if you went to the gym today and you had a workout, you might feel that workout. You're going to feel sore. You yourself are going to feel that workout. But could Marcia look at you and see a difference? Probably not. You might be a little sweaty, or she might smell a difference, but she's not really going to see a difference, And so, and this was, how it went. And I took a picture before we started, and we did the Q-switch laser. We got a little deep tissue coagulation. She felt a little tighter. We infused a serum with some electromesotherapy and did a collagen peptide infusion. And, her skin looked more hydrated. She's got that biostimulation that's really going to peak more down the road, weeks to come. But she was thrilled. I handed her a mirror, and she was like, oh my gosh, like, I have lips again. My skin looks hydrated. Look at these lines, they're softer. And she was thrilled, and here's somebody who had, never been in before, and she loved it. And, and then it's like, okay, now going forward, I'd like you to, a membership would be a great way to keep this going. And again, using kind of the gym analogy for them to understand how this is really biostimulation. This is not, an instant gratification. It is a journey. And what was kind of interesting is I asked her, I said, do you have a cell phone? And she said, yes. And so I quickly put a before and after, no filter, anything, just did a quick side-by-side before and after. And I texted it to her. And I said, well, here, go show Marcia this. And, Marcia walked in yesterday and made an appointment.
She did.
So, but people love that kind of stuff, but it's kind of starting out simple, kind of getting them on board, educating them, giving them a little bit of gratification, and hoping that you're building that long-term, relationship with them,
That's an amazing story. I absolutely love that. I love the fact that you put on the gym analogy there, because it's so true. I think, if they're thinking immediate transformation, it's about consistency. It's about discipline,
100%,
getting them, into the practice, really taking the benefit of the entire approach. And really, I think, like, also to build on that, there's some patients or some people that go to the gym and they use part of the equipment, right? Maybe they skip leg day.
Sure.
Maybe they don't take advantage of the nutrition plan. And when you put everything together, and you have a nutrition plan, maybe you have a trainer, you have discipline, consistency, and maybe you have peptides and GLPs, like, you're going to see transformation over time.
The results. Yeah.
That's the results. That's the results we're talking about. I love it. So where do you see things going in the next 5, 7, 10 years? Now that you have everything incubated and patients flowing and hitting all the verticals, where do you guys see this going in the next few years?
Well, our plan has been to develop protocols for everything that we do. So then we can hope to open up some satellite clinics, force multiply ourselves. That's been the biggest thing, reproducing us. We've kind of become specialized, so it's really tough to find someone. And if we do find someone, it's going to be more on merit and attitude, because we'll just have to train them up as we see fit. But that's kind of what we're doing right now, is just developing all those system protocols to be reproducible and
bringing people in
and outreach, so some people come, and then we want to be able to get out there as well to greet them as well.
I love it. Giving back to the community, helping others, spreading the word, creating standard operating procedures, protocols. I think you guys have a tremendous future. Obviously, you guys have had a huge impact to the community, and we want to make sure that we spread that impact across the nation. So I appreciate you guys coming on. I love the conversation, because this is where I see healthcare going, is really everything tied together, one rooftop, the ultimate result, transformation. You guys you're not just running a business or even a platform. It's really a movement. It's a movement around confidence and wellness, and it's extraordinary. So I think my last question for you would be, why are you so passionate about it?
Well, I think because, it's nice to see people thrive. We like people we like to see people have a come up, rather than, put people down. We like to see everybody raise up and be better people, so that's only going to be positive, I think.
Yeah, I think so. I think that like I said, our beginnings were in exercise science. We've always been interested in wellness. We knew immediately after graduating with a bachelor's degree, we wanted more. We wanted something more medical. This is a whole nother tangent, but I had a car accident and knocked a bunch of teeth out. And so I spent a lot of time in the dental chair, and that kind of changed our trajectory into going to dental, because honestly, I was going to go into nursing. He was going to go into physical therapy, and we pivoted and went to dental, and really liked working in head and neck and the cosmetic part of that. And that kind of pivoted us originally. And, we ourselves have seen a come up, we've seen ourselves improve and so forth. And we love helping others. I mean, we are caregivers at the heart, not business people. And I think that shows in our business. And so we're just very passionate about, somebody seeing their journey and their glow up. I mean, like when a patient gets done, and this happens very often, they just give you a big hug. I mean, that's the best, that's the best. And these people, I mean, you're on this journey with them, these patients that really believe in what we're doing, and you're there through life events. Their kids are getting married. They're becoming grandparents for the first time. Their spouse is passing away, and you're right there with them, and you build this relationship, and you truly want to see them succeed and help them to be the best that they can be, and improve their quality of life, right? I mean, we can't stop aging, right? But we do want to have the best quality of life that we can while we're here. And so, and I personally myself, I mean, I felt like with my medical doctor that I was going to, it was a female doctor. I mean, I felt very, very shut down. And when I just started asking questions about well aging and so forth, and when the time comes, what are your thoughts on hormones and so forth? And I just felt very, well, you're going to get old, that's part of life. Just you can't stop aging, and the problem with you is you'd be using it for anti-aging, and you're going to get old, I mean, that's what I heard from a female medical doctor, and this has not been that long ago. And so I don't want to be that person. I want to be warm. I want to be inviting. I want to encourage people. I want to be your biggest cheerleader, and just help people just feel good during that aging process. I mean, I can say myself, I mean, I feel younger now than I did 10 years ago. We were looking through old pictures the other night. My daughter was like, Mom, how old were you in this picture? And I was like, gosh, I don't know. I think 38, and she's like, oh my gosh, you look older here than you do now. And so, we're believers because we believe in it ourselves, and then we love helping people too. So
got those user of your own product. Love that.
Got those who need and those who feed. We just happen to be feeders.
Those who need and those who feed. Yeah, absolutely. Yeah, use your own product, get it out there to the community, have passion around it.
Yeah.
Really uplifting people. I absolutely love that. So if people want to connect with you, they want to find you, maybe come in and see you, maybe consult with you, other providers, where's the best place for them to connect with you?
Yeah, probably. Like I said, we are kind of unique that we have this dental beauty wellness, and we have kept things kind of integrated but separated at the same time. I feel like Dolly Vita Aesthetics is what our aesthetics portion in our salon is. And so I feel like we have a lot of information on there. Of course, we have wellness, or we have websites and so forth, dollyvita.com and dentalbeautywellness.com. And Mind and Body Wellness by Lindsay. So we have some different platforms out there. Yeah. Say that's kind of been our thought process at this time going forward, and what to force multiply and so forth. So we've kind of kept things together, but also a little bit separate too. So that if people can find what they're searching for, and you can get some direction there on websites and so forth to other platforms.
You can just find me on Jon Hendrickson DDS as well. I pretty much just reproduce everything we put out on Dolly Vita.
They tag you and you repost it.
That's right. That's right.
That's right. I love it. All right, Dr. Jon, Michele, it's been an absolute pleasure. Really, really enjoy the conversation. Thank you so much. This was
Thank
incredible.
you, Cameron.
Yeah, thank you for having us.
Of course. And, my only ask for the audience, guys, is if you found this particular episode, this conversation valuable, share it. I know that there's somebody out there, maybe you're thinking about it, a friend, a colleague is thinking about it. Please share it. I'll leave it at that. Until next time, happy injecting.
Thank you.
Thank you. Bye.
Okay, I'll leave this open for a sec.